filtering through at a really fast rate. So we'll just give it another few moments, and then we'll do a real deep dive into everything that we offer at UNSW on the medicine and health front, and a really specific focus as well on our Bachelor of Medical Studies, Doctor of Medicine program. So look, we'll give it another 30 seconds or so. As we do so, I'm just going to pull up the chat on my other screen. So look, as we go throughout, I'll hold all the questions till we get to the very end. But do feel free to drop your questions into the Q&A. More than happy to answer as many of these as we have time for at the end. And we're very fortunate as well to have one of our other colleagues from UNSW who's going to be in the UNSW booth all day today. And we'll be more than happy to answer any of your follow-up questions from the Med Talk. Unfortunately, I have to duck off straight after this, so I won't be able to hang around after 2:30, but my colleague Soon Chu will be in the UNSW medicine booth, the UNSW booth, and happy to talk about anything and everything UNSW medicine related. So look, we've got exactly 20 attendees and people are still joining, which is brilliant. So look, we might dive into things in the interest of time. As I said before, to everyone who's just joined, throw your questions into the chat and we'll answer them at the very end, time permitting. So look, my name's Nick. I'm our Senior Recruitment Product Manager for the Faculty of Medicine and Health here at UNSW. It's a terrifically long and unnecessary title, which really just means that my role is about ensuring you get the answers to all the questions that you need when you're deciding which universities to study at. And specifically, it means I know as much as is humanly possible about our Faculty of Medicine and Health. So it's a really good opportunity to be able to ask all those nitty-gritty questions that you might have and really find out exactly what it is about UNSW that makes us such an amazing and phenomenal institution to be doing medicine at. So we'll dive in, and my screen hopefully is, there we go, it is working. I'll give a little bit of an overview as to who we are, and for those of you who already know about UNSW, brilliant, but for those of you who don't, look, we actually date back as an institution to 1949, and that's really significant because as a university, we really were founded to step in after World War II and fill the gap, particularly in New South Wales, but also Australia more broadly, a gap of those experts in the sciences and engineering. And so we really started off as a technical institute. But since then we've grown, we've got 60,000 students, we have 300 plus degrees and a whole myriad of double degree options that we have available. And we're an enormous research powerhouse. We're a top 50 university, and it means that we've expanded really to cover 6 different faculties, everything from medicine and health to arts, design and architecture. Our business school is very, very highly ranked. Law, we're in the top 10 in the world. And it means that there's lots of different unique combinations that you might choose to study across those faculties. Now, obviously you're here today because you really want to focus on medicine and health, and that's really what we'll dive into. But it's important to know that behind all of our faculties, we've got a work integrated learning platform, and it might not mean very much to you now, as it's one of those kind of university phrases that gets thrown around, but it effectively is a whole team of people who work centrally in the university to make sure that we're embedding as many practical and internship-based opportunities and industry connection opportunities, engagement opportunities in all of our programs. Now, the medicine program is fantastic because it's got the final 2 years are you in hospitals full-time because it's the best way to learn. And in fact, from your first few weeks in the medicine program, you're going to be out there in hospitals getting acclimatized to what it's like to be in a clinical environment, engaging and interacting with patients, and really easing yourself into what it is like to be working within that kind of a context. But across all of our degrees, we make sure that we're embedding similar industry engagement opportunities because it's really important. It's one of the best ways to learn. Now, in terms of UNSW medicine specifically, as I mentioned, we're a top 50 university and we're similarly ranked for medicine. We a world leader in areas like cancer research, neuroscience, mental health and addiction, communicable diseases. Our School of Population Health have been driving, particularly in Australia, the COVID-19 response, and they have a lot of academics and leaders who are feeding into the Australian government and helping orient and drive the COVID-19 response, because it really is about linking the academic research and that acumen and knowledge with pragmatic responses. We also, very fortunate to have our medicine program extremely in demand, within Australia. So it is one of the most in demand programs. It has been the most in demand degree in New South Wales for the last 4 years. And it really reflects the fact that there's some phenomenal practical opportunities that we'll talk about, some phenomenal social and networking connection opportunities, but also you're going to be part of a community that really wants to, oh, hang on, is my microphone muted? Can anyone hear me? Sorry, I've got someone who has reached out to say that my mic might be muted. I think it's working. I can double check. It looks like my microphone.
Yeah, it's working actually.
Oh, it is? Okay.
Yeah, ZY2, you might want to maybe off and on your mic again. So that, yeah, I don't think it's your side, Nicholas. Thank you so much. Thanks.
All good. All right, we'll kick on, and hopefully that student can work out their tech issues. This will be recorded and available on demand as well, though, so not to fret. In terms of our medical program, though, the other really big aspect of it is that you're going to be part of a community that is really striving to increase the quality of standards and the quality of healthcare more broadly. And so you'll work very closely with academics. We'll talk about the research opportunities that we embed in these programs as well. And it really is about linking you in with those academics from the get-go. So, oh, sorry, I've gone slightly too fast there. In terms of UNSW and what we offer on the health front, there's a number of clinical programs and a number of non-clinical programs that you might consider. So if you're thinking, I want to be on the clinical side of things, we offer exercise physiology. We've got our medicine program we're going to dive into. Things like psychology. If you're interested in optometry, we have a vision science master of clinical optometry program. But you can equally make a real impact through a non-clinical career as well. And so you might consider things like medical science, whether you become a medical researcher. You could work in areas like pharmacology, for example, if you do, say, a Bachelor of Advanced Science program. Our biomedical engineering program equally allows you to, I've known students who have invented small biomedical implants that have gone on to be patented, produced, en masse by companies, and gone on to change huge number of people's lives. And it really is the fact that there's many ways to make an impact across healthcare, and it's about working out for you exactly what that's going to look like. So diving into the medicine program now, it is a 6-year program. So it really is a very immersive program, and we split it up over 3 phases. So it's a Bachelor of Medical Studies, Doctor of Medicine. And in your first phase, we really focus on upskilling you across the biomedical, the social sciences and the clinical sciences. So giving you the fundamental knowledge really to be able to then go out there and feel confident in your placements and really be able to engage at a very high level across medical research and medical research material. We embed scenario-based learning into this from the get-go. So you're not just going to be learning a whole bunch of important facts and ideas. We really are about engaging you in scenarios and trying to problem solve, because as a clinician, that's a lot of what you do. You are problem solving, trying to come up with solutions. And it means that your work is part of teams. We actually teach the first 2 years by mixing the cohorts. So the first year students study with the second year students. And then when you're a second year, you're going to be studying with the new first year students that are coming in. And so we stagger the courses so that you actually build those connections across multiple year groups. So you'll know people who are the seniors above you, but you also know the junior students who are coming in. And it means that there's a really positive and vibrant network there and community across our medical students. When we move into phase 2, this is where we really ramp up the clinical side of things. So in your first 2 years, as I mentioned, we actually do throw you straight into the hospital settings. You'll probably spend about 2 days a month out in the hospitals, getting a feel for what it's like to be in a clinical environment, engaging with patients. But we gradually ramp that up throughout the entire program so that by years 5 and 6, you're wholly in the clinical teaching hospitals. You're wholly there, throughout the week, really, immersing yourself in that clinical experience, engaging with patients, working with doctors, it is the best way to learn. And so phase 2 is where we start feeding in large chunks of those clinical experiences. So you'll have those integrated clinical courses. Students have the opportunity as well. We've got a number of metropolitan hospitals we teach out of, but equally we have 5 regional and rural clinical campuses. So you can go rural for up to a year if you want to, and it means that you actually typically in those hospitals get even more hands-on and more immersed in the learning, because it is a very tight-knit community out there. In your 4th year, you'll do an independent research project or an honours year. And this is really what makes our program stand out, is the fact that research is built into it and given a full year, because it is something that you're going to be doing for the rest of your life. As a clinician, to give the best possible patient care, you really need to be staying at the very forefront of your particular field. So if you're a specialist, a cardiologist, for example, you need to be staying on top of whatever those latest developments are so that your patients can be given the best possible care and treatment. And so you're going to, as a clinician, you're going to be learning for the rest of your life. And it's really important to be able to build those strong research skills. And it equally sets you apart as well when you're going out into the workforce and beginning your medical career, to be able to have those research skills. In many cases, students were able to get their work published in journals. I know one student who ended up going overseas to both Tokyo and New York to present her findings. So there's lots of opportunities really to be part of the academic community and the research community, because that is very much another career pathway that graduates pursue typically later on. So you might be a clinician for 20 years, and then as you get into kind of senior positions, you might end up being a clinician several days a week in a hospital, but then spending the other several days as an academic, teaching and sharing that knowledge and your expertise. And then we move into years 5 and 6. As I said, full-time clinical placements, 5 days a week. You're immersed in those hospital settings. We cycle you around a number of different wards, so you'll have many different experiences across the different types of medicine that's out there. And it really is about giving you a bit of an idea as to where your career is going to head, what you're particularly interested in, and going from there. I did dive deeply into the independent learning projects and honours, but as I said, it really is one of those things that stands out, and students, I think, maybe have a bit of a misconception about what research is. So I know I've spoken to many students who say, oh, I don't want to spend a year cooped up in the library. I want to be out there engaging with patients. And I can tell you that is what this kind of research project is like. It is about making sure that you are learning firsthand. And so you'll generally be, be working under a senior academic who'll guide you, but you'll also be, working out in the hospitals, doing your research, obtaining surveys. I know one student who was working on ectopic pregnancies, and so whenever an ectopic pregnancy came into the Royal Hospital for Women and Children, they'd go out there and they would be, engaging with those patients at a very vulnerable time for them. It was a really vulnerable time for those patients, but that they were, sharing their insights and their expertise so that we could better the treatment as a whole of people who had ectopic pregnancy. So you'll very much be engaging with patients, working with researchers and working with academics to create, a new piece of knowledge which can really better the lives of all of the patients that you're engaging with and those beyond. Now, what does studying medicine actually look like? Many of you will know it's a long haul that you'll be studying medicine for. And the reason for this is because we want to make sure that you're giving amazing treatment to your patients, but that you've got the knowledge, the confidence, the experience to be able to do so in a really strong way. So our program is a 6-year program. You then would do an internship year followed by 2 years of residency at a hospital. And then you might consider going down the route of vocational training. So vocational trainings, if you want to become a general practitioner or a cardiologist, if you want to be a specialist in a certain area, you would then go on to do that subsequent training. So look, there's no beating around the bush that a career in medicine is something that you're in for the long haul, but it is something we vet as part of our interview process, which I'll talk about in a moment. And it really is about making sure that you're mature, you understand that this is really a lifelong commitment, and that you really want to be in it to make a real impact, because it takes a while to become an expert, particularly if you're going to go down one of the specialties which are on the screen here. So everything from being a pediatrician to a general practitioner, if you work in anesthetics as an anesthetist. It really is about making sure that you're an expert in that field. So We've also kind of broadly spoken about some of the non-clinical careers. So our students, they go on to clinical careers, but they do also go into work in education. They work in public health, they work in advisory roles, policy making, they work for the government. There's many different ways that you can make that impact. So it is important to know that, you know, the clinical skills and the clinical pathway is always going to be there, but it's really just one pathway. You've also equally got many others open to you. Now, in terms of where we teach, for those of you, you know, you're coming from Singapore, I imagine most of you, so you probably don't have a huge familiarity with these particular teaching hospitals. So I'll give you a little bit of context that the metropolitan ones are in the Sydney Basin, so the broader kind of Sydney area. Prince of Wales Clinical School, though, is literally over the road. So if you have a look at this building here on the screen, this is the Wallisworth building. It's where we do our cancer research. And if you were able to just pivot the image slightly and look on the other side of the road, that's where the Prince of Wales Clinical School is. And there's a huge construction site because we're actually building a whole new translational teaching hub there as well as part of the Prince of Wales Clinical School. So we're on the doorstep effectively of one of the biggest hospitals in Sydney, but equally we work with a number of other hospitals as well across the Sydney area. And we try and cycle you around so you get a feel for what it's like to be in those different environments. We've got those rural clinical campuses I spoke about. These are spread all across New South Wales and equally give you a different understanding of how medicine works, how treatment works within a non-metropolitan environment. So, you know, regional medicine is a bit different in terms of the kinds of ailments and treatment that you're offering and the kind of resourcing that hospitals have as well. And so it gives you just another perspective that can really help set you apart from graduates, you know, when you go to apply for internship or residency years. Now, the nitty gritty, which I'm sure many of you are holding out for, is how do you apply for the medicine program? So there's two kind of key steps here, and then I'll break down the nitty gritty of what we're looking for in terms of academic requirements. So the medicine application portal is the first thing you need to apply through. So that's a direct application to the UNSW Faculty of Medicine and Health. It allows us to, you know, get a broader picture of your interests, your desires, why you're applying to medicine, and captures some of that information so that we can use that later on when we're going through the interview process. So you need to apply for the medicine application portal. You also need to apply directly to the university. So this is where you submit your academic results and you know, choose your degree you're applying for, all, you know, kind of the broader level university application. So if you are and we'll get into the differences here as to whether you use Apply Online or UAC International. Most of you will use the UNSW Apply Online portal, but you'll apply through UAC International, the university's admissions centre, if you're studying an Australian secondary qualification or the international baccalaureate. So most of you, I imagine, will be applying directly through UNSW Apply Online. So two-step process. Here's the English language requirements that we're looking for. It's important to note that if you are coming from an English language speaking country that's recognized on our English language requirements website, and if you're studying your senior secondary studies in English, then you don't need to supply an English language qualification. So best to jump onto the website there and just double check based on whichever qualification it is that you're studying. And then the selection criteria. So there's three elements we're looking at. The first is academic merit, so your senior secondary study results, an admissions test, so either the ISAT or the UCAT-ANZ. And then if you're, so we compile those two elements. If you're competitive, so if you've got a high result overall based on those two factors, then we'll offer an interview. And then based on those three factors, so the academic merit, your admissions test, and your interview, that's how you get into UNSW Medicine and Health. On the academic merit front, I've got a list of kind of common qualifications, and these are the minimum entry requirements we consider. Now, the ATAR is the Australian Tertiary Admissions Rank. It's the senior secondary results that you would get if you were studying here in Australia, and then we moderate that against similar qualifications. So you can see the Singapore and Cambridge General Certificate of Education Advanced Level. The entry requirement is, minimum entry requirement is 22, and we explain how that's calculated on our website. So if you just type in UNSW Bachelor of Medical Studies into Google and you pull up the degree finder, which you can see the link is on the webpage there, the slide there as well, that will enable you to look at the nitty gritty of how that's calculated. But It's important to note that this is the minimum entry requirement, and it is a very competitive program. We receive close to 4,000 applications every year for this program, and we have an intake of about 300. So it's about 200 domestic students and about 90 to 100 international students. So really important to remember that that's the minimum entry requirements, and the actual cutoff for that particular year is often a lot higher. For example, the ATAR equivalent, minimum of 96, but typically, and it's out of 99.95. Typically, we see that landing in the high 99 mark. So it is a really competitive program, and it's important to remember that. And we'll talk about some of the other options that are available to you as well down the track. Now, the admissions test side of things, you've got the International Student Admissions Test that you can sit, or you can also sit the University Clinical Aptitude Test, ANZ, so the Australian New Zealand version. There is a UCAT UK, but we only accept the UCAT ANZ version. So depending on where you are going to be throughout this year and where where you're going to be best situated to take an exam, I imagine many of you will be taking the ISAT, but the UCAT ANZ is equally an option for students. So take the earliest possible exam, apply as early as possible, because it really maximizes your chances to be considered. The latest that you can submit these exam results is the 30th of November. Now, then we offer an interview, and the interview really is designed to test your communication skills. So really, it's an informal chat with two representatives from UNSW, from our Faculty of Medicine and Health. Generally, one of them is a doctor, and it's designed to get a feel for who you are, what your motivations are for getting into medicine, to understand and get a feel for your communication skills, and also to get a sense of your maturity as well. Because as I mentioned, diving into a career in medicine and health is a really significant commitment, and we want to make sure that the students we're getting into our program are there for the right reasons, that they're going to make a real impact. And so that's really what we're looking for in the interview. So the big thing I'd recommend, though, is avoid coaching. A lot of students go down the route of getting coaching and practice, but we can always tell when a response is really rehearsed. We're not looking for that. We're not looking for perfect responses. We're looking for who you are. We're looking for that authenticity. So really recommend that the best way to prepare is just have a think about who you are, what you want to get out of the medicine program, what you bring to it, some of your skills, and link that to your experiences that you've had so far throughout your life, particularly those you've had throughout your secondary education in high school. Here's a list of some of those key dates. So your admission results must be available by the 30th of November for the admissions test. You've got to submit your UAC international application if you're applying, because you're studying an Australian secondary qualification, or the IB, by the 30th of September. Otherwise, you've got to the 30th of November to apply online and submit your map. But really, we recommend doing that as soon as possible, because we offer interviews on a rolling basis. So they're held from April all the way through to mid-January, but it is a competitive program. So the earlier you apply, the better. Here's a bit of a deeper dive into those timelines. I'm not going to cover this in detail. You can jump onto our website. The link is below on the slide, and that covers this in much more detail. So best to jump onto the website for that. And if anything is updated as well, it's always first updated on the website. Now, a lot of students ask me, what happens if I don't get in? What are my options? Well, the reality is that medicine is a competitive program to apply for, and we actually capped the number of places we can give out every year to make sure that there's enough practical placements available for students, to make sure that there's a regulated number of doctors who are kind of going into the workforce afterwards. So they've got internships and residency opportunities available to them. So we'd love to take more students, but we are capped at generally 90 to 100 international students each year. So make sure that if you're unsuccessful, you keep at it. I mean, it really is, if you're passionate enough to get into to want to have a career in medicine, there's always a way to get into it. So we'd really recommend keep applying year after year. So you can sit you'll have to sit your ISAT or your UCAT ANZ, depending which one you do. You'll have to keep sitting that year after year, but you can reapply, and we'll take into consideration either your secondary school qualifications, or if you start a degree, we'll take into consideration your tertiary study. So there's a minimum requirement. You have to have a 96 ATAR equivalent as a minimum, and a WAM, so a weighted average mark in your university studies, of a 70 or equivalent. But then we'll take the best of those too. So if you meet those minimum requirements, but you've performed really well in your first year of university, then brilliant. We will take that on board, and we'll just look at your university results. So It really is about choosing a degree you're passionate about, because you're going to perform well in it. You're going to put in those extra hours. You're going to be, burning the midnight candle effectively to do the best that you can in that degree. So choose something you're passionate about. Often students will choose those that are related to medical fields because they've got that interest. Brilliant. But choose something you're passionate about because you're going to do well in it, and it sets you up for your career. You can also apply for postgraduate medical programs. So if you haven't got into UNSW's medicine program by the end of your undergraduate degree, so the end of your bachelor's degree, then you've actually got the opportunity to keep applying for our program and then apply for postgraduate medical programs around the world. And there's a number of them that are offered in Australia. So our colleagues at the University of Sydney, our colleagues at the University of Melbourne offer them. I can see a question has come through as well. Do we have a postgraduate medical program? So our program is undergraduate entry. So it's a Bachelor of Medical Studies, Doctor of Medicine. So it is that Doctor of Medicine component, but we don't have postgraduate entry just into the Doctor of Medicine program. So you have to come in and do the full 6-year program, starting off with that Bachelor of Medical Studies. So we don't offer postgraduate med by itself, but again, there's a number of other universities in Australia that offer that, and they're fantastic programs. And then the other thing you might consider is just other clinical and medicine related careers. So again, I can see there are a few other questions coming through. How many international students are accepted into our program every year? Again, it's around 90 is the number, sometimes slightly higher if there's availability, but normally around 90. And on the international side, we get about 700 applications. So we have a huge demand domestically as well. That's why there's about 4,000 applications we receive in total overall. But the international numbers, we have about 700 applications and we take about 90 students. So just really, if you're passionate and you're committed to medicine, just keep applying because there is always a pathway, and apply for every medical school you can, just keep your options open. I'll wrap up by saying that there's more to medicine than just being in the hospitals, being in the clinical settings, and being on campus, having your classes. Our MedSoc run part of the social side of things. We've got 300 clubs and societies at UNSW. It's a beautiful and vibrant campus. And our MedSoc really take care of our medical students. They do advocacy. They run things like the review that you can see there on screen, where they all dress up, sing, dance, perform. And they run lots of other opportunities throughout the year to really support you to make the most of your medicine program. So they help you with assessments, they help you with extra tutoring, and also just some of those fundamental clinical skills that you'll need. They also run workshops to support students as they go into those new environments. So lots of opportunities there as well to really get involved and be taken care of. We've actually got a Singaporean Medical Student Society as well, specifically for students who are coming from Singapore and studying our medicine program, because we have such a high volume of them coming through. So it really is, it's about getting involved, because it's balancing that academic side of things with everything else that exists outside of the classroom, all the student experience. I'll answer the final questions that have come through as well in a moment. We've got lots happening at UNSW though, so if you want to stay in the loop on some of those key application dates, some of our information evenings, our open days and that, obviously connect with us. And if you've got nitty-gritty questions that haven't been answered, look, you can definitely reach out to Soon Chu, who's going to be in the UNSW booth for the rest of the day, and she'll be happy to answer your questions. But you can also reach out to our Future Students office. You can live chat, you can shoot us an email. We're always happy to chat and support you on that pathway to wherever your dream degree is. So look, I'll take a few questions in the last 50 seconds that we've got here. I'll do my best to get through them. What languages for the GCE A-level result would be considered? Look, best to check that with Soon Chu. She'll know what that is. You can also jump onto our degree finder. So just type in UNSW degree finder, navigate to the medicine program, and it lists all the English language requirements, and it equally lists how we assess those senior secondary qualifications. What's the cost of the undergraduate medical program? Can't remember off the top of my head. It is a significant investment, obviously, but the best thing to do is to jump onto the degree finder. And I'll look, as we wrap up the session, I'll equally post the degree finder link into the chat. Do students learn medical content while doing the bachelor's? So it's not a bachelor in medical science. It's actually a bachelor in medical studies, where we do cover a lot of the medical sciences, but it equally is integrated with the medical content as well. So you definitely learn the medical content from the get-go. It's a medicine program. That's really, it's preparing you to make the most of those clinical experiences, but we definitely have that from the first year. And that's I think that's most of the questions that have come through. I will quickly throw into the chat while we're all here. I can see more questions.
Yeah, I think we're running out of time, Nicholas.
That's okay.
So, yeah, thank you so much for the insightful sharing. We appreciate
No worries.
it. For students, you can just head on to the lounge room if you have further questions. Yeah, then I think you can speak to our counselors or our uni reps for your further questions. All right. Thank you so much, Nicholas. We appreciate your time today.
A pleasure, and all the best to the students who joined us. Good luck with your studies.
Yes.
Hopefully we'll see you soon.
Okay, great.
No
Thank
worries.
you.
Bye.
Bye.